Hi, and welcome to this second webinar of our Nordic Research Network Health and Welfare Technology. My name is Bengt Andersson. I'm a senior advisor at the Nordic Welfare Centre. And with me here from the start, I have Helena Melkas. Helena.
Yes, thank you. And welcome also on behalf of the chairpersons of this Nordic Research Network. I am Helena Melkas, working at Lappeenranta-Lahti University of Technology in Lahti, Finland, as a professor of service innovations. And I'm chairing this network this year together with Anna Forsman from Åbo Academy University in Vaasa. I hope you will have an interesting afternoon. Warmly welcome. Thank you.
Yes. I will share my screen here now, and there we go. The focus we have today is health and welfare technology for children, adolescents, and young adults with intellectual disabilities. But I think we should start with saying something more about our network, the Nordic Research Network Health and Welfare Technology. The aim of the research network is to consolidate knowledge, research, higher education, and experiences in the field of health and welfare technology. And that with a user perspective, both from an end user perspective and their relatives, but also with the perspective of people working, the staff working in our welfare organizations. And you can look at this link to know more about this network. And Helena, we have activities going on this year, haven't we?
Yes, indeed. There is a web page for the members of the network, and we are looking forward to having an active flow of information also from all the members. So that's one type of activity. And then we are going to arrange another 2 webinars in the autumn after these 2 now in the spring. We will also prepare joint research proposals and participate in various events arranged by others, such as the Nordic Council of Ministers, and also events such as the HIMSS conference, EHIN conference, Vitalis, and so on. Then we are also planning to have a network meeting in December this year, and we have an ongoing joint project already that's called Protect, and it means proactive health and welfare technology for Nordic users and societies. And that's a project that arranges workshops, and we will be updating information about its progress on the website later on this year. Thank you.
Yes, so there's a lot of things going on, and we're really happy to have this network. We are around 50 members of this network right now. Now back to today's program. We will have this focus, as we said, health and welfare technology for children, adolescents, and young adults with intellectual disabilities. And we see that this seminar, we will present the results from 5 years of research from interventions in the Norwegian municipalities with a user-centered approach in implementing health and welfare technology to children and adolescents with intellectual disability. We will also present experiences from how user-driven innovation and design activities with people with intellectual disabilities can be conducted. And you see the program here. Helena and I have welcomed you. Then we will have a presentation from Undine Knarvik. You have the possibilities to put down questions in the chat. I will be the chat moderator here today, so I will pick up what you write and the questions you write down in the chat and ask them to Undine. Then we will have a presentation from Chris Safari, and also there we will have questions and comments. And then at 2 o'clock, we will have a panel discussion led by Gunhilde Rothvold. So that's how the program looks today. We will close the webinar at 2:30. And then I also would add that there are possibilities to get subtitles. We have written interpretation. You could say subtitles. You go into the closed caption button, CC button, and you can get get text what we are talking about here at the same time as we say it. In fact. All right, I will stop sharing here now and. Welcome our first presentation and presenter here today, and that is Undine Knarvik. That is a senior advisor and PhD student at Norwegian Centre for e-health research. Undine, are you there?
I'm here.
Very good, very good. Welcome.
Thank you, thank you.
Yes.
Can you hear me?
Yes, I hear you very well. And you could start sharing your presentation if you want to. And as I said, we will hear about 5 years of research, health and welfare technology for children and adolescents with intellectual disabilities. And there you go, Undine. I give the word to you.
Do you see my presentation?
Yes, we see it very well. Perfect.
Thank you very much.
Thank you. And I remind you all out there, write questions in the chat, and Undine and I will have 5 minutes I could put questions to Undine from you. Yes, go on, Undine. The word is yours.
Thank you, Bengt. Thank you very much. Yes, as Bengt says, I will present our research and assessment on welfare technology for children and youth with intellectual disabilities. This work has been conducted by myself, Undine Knarvik. I'm not yet a PhD student, but hopefully to become. I'm a social anthropologist. The work has also been conducted together in the team with Marianne Vibeke Tronsen, senior researcher and sociologist at the Norwegian Centre for e-health research. All of us are working there. And Gunhilde Roth-Woll, sociologist and PhD student. Shortly about what I will talk about, the 5 years of research, the phases. We are going through the research questions and the methods we have used. About 2 knowledge summaries we have conducted. Then the user experience study, actually 2. Then the study about organizational preconditions for welfare technology. And at the end, very short, the study about welfare technology is part of a holistic service offer. These projects have been conducted in collaboration with the Norwegian Directorate of Health. In 2013, the Directorate was committed to start a Norwegian welfare technology program together with the Directorate of e-health and the Norwegian Association of Local and Regional Authorities. The basis for this was that they wanted to assure that welfare technology was well used through financiation of municipalities and to financing their trials and the work on welfare technology. And with regards to this topic, children and youth with intellectual disabilities, there have been up to 2020, 6 municipalities trying out or testing welfare technology for the target group. We have collaborated with the Norwegian Welfare Technology Program and have provided research and assessment on this topic. And the goal for the project is to look whether welfare technology can support social participation and mastering of leisure time activities of children and youth with disabilities. I guide you shortly through the phases. First, the knowledge summary, then the trailing research on user experiences in 2 municipalities. The second phase, looking into organizational preconditions for implementing welfare technology, and based on interviews with people working in 4 municipalities, Norwegian. And the third phase, there we have actually looked at user experiences 2.5 years after the first trial. We have conducted an international knowledge summary, and our last study was about welfare technology as part of a holistic service offer for the target group. And here we have interviewed, we're looking on 3 perspectives: the user, professionals, and the management perspective. The research questions were whether and how can welfare technology be useful to children and youth with disabilities? What significance can welfare technology have for participation and mastering of leisure time activities? Then whether there were changes in use of welfare technology over time. As I said, what are the organizational preconditions for successful implementation of welfare technology, and how can welfare technology become part of a service offering to children and youth with disability? Very short, the methods, we use qualitative methods, interviews, where we interviewed in the first round 19 parents of 18 children, and 5 of the children were attending, and there were short conversations. 10 technologies were tested. In the second phase, we interviewed 16 professionals, and here it was 4 municipalities. In the first, it was 2. In the third phase, we had 2 focus groups with 9 parents in total. And in the last study, we interviewed 11 informants related to a child with Down syndrome. And that was both interviews and focus groups. There were 5 groups of categories for the technologies tested. Technologies for supporting speech and communication, technologies for supporting that the child gets overview over time, planning and structuring of the day, localization technology, collaboration technology, and educational games. Here's an overview of the 6 reports we wrote and 1 Norwegian scientific article. All can be approached in our website. You will see later on the address for the website. If we start with the knowledge summaries shortly, we conducted first some very, how you say, short time. We had short time for this literature review in the Nordic countries, and that we used, we were looking after articles, evaluation reports that said something about experiences with the use of technologies. The international literature review, I will talk a little bit more about. Here we have two reports that we call knowledge summaries. And you see the Nordic was conducted in 2016 and international in 2019. I don't go very much into the different summaries. What is important for you to know is right now are the results if we compare the first knowledge summary with the second one. And what we saw in 2019 was that there were actually new technologies tried out compared with the first. And these were virtual reality, robot and gaming technology. We saw also that this was mostly, the articles were mostly related to simulations of daily activities in educational settings. And we concluded that there was also a need for more knowledge on implementation and organization of welfare technology. Just need a little bit water. With regards to the user experience, we conducted two studies, one in 2017, one in 2019, mostly with the same families interviewed. The one in 2017, and this is only really a short insight, is that the parents saw a potential with welfare technology. Welfare technology, and this was on 6 areas. Welfare technology could support independence. It could give the children overview, control and predictability, could support communication and social participation, and also provide safety for both parents and children, and actually provide removal of workload for the parents or load for the parents. It also could lead to a feeling of normalization, and it could be a good instrument for play, entertainment, and interest. I will give a quote related to normalization by one of the parents that will give you a feeling of what is meant by the potential of welfare technology. And here it is, where one parent said, sometimes he calls us with his watch. It was a GPS watch. Although we know where he is, he thinks it is fun to say where he is, or to say, I'm coming now, and that we make appointments. Other kids do, so he thinks it is cool to do so. Okay, shortly about experience, a parent's experience after 2.5 years. They have gained more experience in using welfare technology, and they were also more reflected on, more reflected on that welfare technology actually should be a part of the services, the general services a child should receive. And they were demanding more holistic service offers. So the following aspects were mentioned by the parents, like the importance of individual adaptation of welfare technology and training and follow up, as well as the importance of coordination, both with regards to support for the families, but also between the actors in order to use welfare technology in a proper way. And it was also about creating how to create a culture in a service for. It was important to create a culture in a service for the use of technology. And they said there should be an equal offer independent of parents' economy or initiative or competence. And at the end, there should be a life course perspective and including seamless transitions and holistic service. But there were also challenges expressed by the parents. And this, amongst other, led to a model we created, which we, I'm sorry, I didn't translate everything in English. I shortly said, the model sums up that there are technological aspects, organizational aspects, and social and individual aspects that that are important to merge, to look at, in order to have the proper adaptation, individual adaptation, according to implementing welfare technology solutions. So this means there is a room of possibilities for technology if you have the user in the center. So we interviewed parents. No, not the parents. We already have talked about that. We had this study about the study about preconditions for implementing welfare technology. And this was from the view of municipal professionals. And we studied it on 3 levels. These levels were the user perspective level, micro level, the facilitator level perspective, meso level, and the management perspective, the macro level. And we see that these levels, one second. These levels demands, and there is an importance of the child's needs and possibilities on that was the user perspective level. And with regards to the facilitator perspective, there will be new practices in the service as soon as you introduce welfare technology, and this should be taken into account when you do that, as well as the macro level where leadership and anchoring are important aspects. An example for anchoring will be that it was mentioned that it was of importance actually to make welfare technology projects visible in the municipal budgets in order to make people on a more higher level responsible. And all these shows a very complex picture with regards to implementation of welfare technology. Very short here. The last study was about welfare technology as a part of a holistic offering. And this was conducted in Bodø municipality, where we interviewed, it was 11 informants around the child. I can say that Bodø had a good ground of basis, because the digitalization initiative in Bodø gave this good basis also for a project for welfare technology for children and youth with disabilities. There were 3 children. They tried out welfare technology for, and they created a service model which was iterative, where they had the elements as mapping the needs of the child, training both child and all the actors, facilitating, coordinating, follow up, and looking again whether the needs have changed. So this was one success factor actually for having a good process for implementing welfare technology. And as you see, we conducted a case study, and with the aim to provide holistic knowledge on how welfare technology can meet user needs and be organized as part of the service provision. We interviewed actors around 1 child, and I think I don't have more slides on that study, but you can read that study. I think it can be interesting. I want to come back to what matters and how to be successful in implementing welfare technology with the user in the center. And there is a last quote from a parent that also is significant in order for this aspect. And it says, he's not going to become independent in all areas just because of this app. But that doesn't matter. What is important for us, as for most of these families, are the small things that become very big and important. The things that make, the things that many take for granted, such as that children can play in the garden, That is not the case for us. But if he can be alone in the garden, that is fantastic. Shortly about the steps ahead, we are planning scientific articles. Result of these 5 years of research is actually the PhD for Gunhilde and hopefully PhD for me too. Thank you for your attention.
Thank you, Undine. Thank you very much. Perfect timing as well. I'm impressed with that. And I say to you, look at this now. If you have any questions to Undine, please put them in the chat, and I will forward them to Undine. I have a question about on one of those last slides you had, Undine, when it comes to how to be successful. We say that we have the user in the center, and I don't know if it's a question or it's maybe just a reflection that this kind of work you're doing, this kind of research is crucial to because we talk so much about that we need to have the user in the center, but there are so many people working and organizations working around this target group. So, and everyone says they have the user in the center, but we need to have the user perspective here. I mean, what's your reflection? Not a question really, but a reflection on that.
Yes, I totally agree, and I'm happy that we actually started our work with conducting studies on user experiences. It was families. We started it with the children were very small, and some of them couldn't communicate the way we would understand. But we think that that it gave us a lot of insight, actually, the experiences by the families, and these experiences were pretty well mirrored in the experiences the professionals had too.
Yeah.
So actually a lot is about but we were lucky also that in all the projects where the user perspectives, they're very good, they're well met. The user was in the center in the projects.
Yeah. And I also think that is interesting to hear that you say that when you concluded in the first you presented here is the need for more knowledge on implementation and organization. What do you mean by that? What do you mean more knowledge about that?
Yeah, this was a result after the study then where we searched the scientific database for experiences and benefits with welfare technology, and what we actually didn't find so much was that type of studies saying how welfare technology can be implemented as part of a holistic service. And but this, I can as well say that the organizational problems according to implementing welfare technology is no news because this is what we are coping with when we are doing research on implementing new technologies.
Yeah. I have a question here from the chat. User is important, but have you reflect how to that affect usability?
Yeah, you're right. And when the model you saw, which I couldn't go deeper into, took this you say brukervennlighet, sant?
Yeah, usability. Yeah.
Usability, took it very much into account. And our first knowledge summary was looking mostly into usability, into what are the, what did we find in the literature that gave us good insights and tips with regards to usability.
Okay, I have one more question about welfare technology in Norway, but I think we save that question and put that back to the panel later on. So you don't have to answer that, Undine, right now. So I say a big thank you to you, Undine, for this presentation and this chat we have now. Thanks a lot.
Thank you.
And we will go on in our program, and I welcome Chris Safari to join us and to present, having a presentation of user-driven innovation and design activities with people with intellectual disability. Chris, you're a PhD research fellow at the University of Agder in Norway. Warm welcome to you.
Thank you very much. Thank you for the invitation as well.
Yeah. You can start sharing your presentation maybe, and go on with your presentation about user-driven innovation and design activities. I think that's very, very interesting. We see your presentation very well. I give the word to you, Chris, and then I get back and we have a little chat with questions afterwards. Welcome, and I give the word to you.
Thank you very much. And again, thank you for the opportunity to present here today. So I will be speaking about inarbeid and needs and user-driven innovation with people with intellectual disabilities. My name is Mugula Chris Safari, or just Chris. I'm a PhD student at the University of Agder in the Department of Psychosocial Health, and also working at the Center for e-Health. Working with my PhD, my supervisor is Elin Tyggesen and also Sophie Vass. Today I will be speaking about our project, but I will mostly focus on the user gains people with intellectual disabilities have had participating in the design activities that we've had. So inarbeid is a needs and user-driven innovation project based at the University of Agder. And the aim is to develop innovative and technology-supported services that will help people with intellectual disabilities transition from school to working life. The project follows action design research and has that as a methodology, and it allows researchers to solve practice-inspired problems through the design and development of technology, also by the support of theory. Importantly, the method stresses the need to involve the end user in the design process to design and develop useful services, which was one of the most important thing in the inarbeid project, to have user involvement. I will shortly talk about the 4 innovations being developed. One of the innovations is a self-reflective career tool for people with intellectual disabilities. This focuses on the area of getting employment and will work as a digital CV for students who are transitioning from school to work or searching for employment. The next innovation is a communication support, which aims at keeping people with intellectual disability in work. So this solution will work towards communicating between the individual, the workplace, proxy, and so on, so that the person can stay in work or employment longer. The third innovation is an inclusive workplace. This aims at helping people with intellectual disabilities get work. This will be a database which can be used to recruit and hire people with intellectual disabilities, where also employers can use the workplace to search for fitting people for different work tasks and employment. So this aims at also connecting employers and people with disabilities in terms of attaining work. The last innovation is a transport support application, which aims at helping people with intellectual disabilities also stay in work. Early, when we were identifying challenges for people with intellectual disabilities in terms of getting work, transport was discovered as one of the biggest barriers for people with intellectual disabilities in terms of employment, getting work, and also staying and retaining work. So these are the four different innovations that the participants have been involved in designing and developing. So the last years, technology design has somewhat shifted from a design-centered approach towards a more user and human-centered approach. So nowadays, designers are encouraged to involve people from the intended user group in the design processes. And this may be through needs identification or the design or prototyping or even evaluation of the technology. And earlier studies have shown that user involvement can contribute to both positive outcomes for the user being involved as well as the technology being developed in terms of user satisfaction, but also other design aspects. However, there seems to be less focus on young adults and adults with intellectual disabilities in terms of participating in technology design activities. We know very little about how they experience being part of design activities, and we also know little about potential user gains. However, when the outcomes have been reported earlier, people with intellectual disabilities have seldom been directly consulted. And also due to difficulties in examining user benefits, the research to date has been limited and somewhat informal. And what makes Inarbeit, or what made Inarbeit perfect for this kind of project is that one should not artificially create technology design teams for the sole purpose of exploring or understanding the effects of participation. Therefore, we wanted to explore the experiences of the participants in parallel to the other research activities and the design activities that were being performed by Inarbeit. I would also like to state that the pictures used in this PowerPoint are taken during the design activities connected to the Inarbeit project. So the participants participated in different types of workshops, ideation workshops, concept workshops, but also in user tests, stability tests. We tested the technology prototypes, but also on paper before creating prototypes on iPads, iPhones, and also computer. Most of the tests were most of the tests were at the classrooms where the students were going to school, but we also had some tests at the lab at the university where we were filming and testing the usability of the technology. We also had user tests in realistic environments. For instance, the transport support application was tested by renting a bus and driving around and trying to figure out how well the usability was, but also which barrier the technology could help mitigate for the person using it. We also used drama workshops as the context of some of the tests we had. So in terms of methods, so in this presentation, I'm not presenting one specific article, but more an overview, and what is being presented today stems from several different publications. However, we had a qualitative and an explorative approach. We interviewed the participants, had some photo voice interviews as well, and used images and picture support during interviews. We also had participant observation and reflective notes from all participants surrounding the participants during the design activities. I would also like to say that we used photo voice also as a method for needs identification, as well as to explore their experiences in participating in the design activities. So I would like to talk about some of our findings in terms of impact of participation on people with intellectual disabilities. So mostly the participants described having positive experiences. Being a part of the design activities was fun, described as pleasurable. And this was linked to several different tasks, for instance, working with technology, taking pictures, drawing, or writing up about their own interests. Most of these things were by some described as exciting and enjoyable. The participants also described having positive emotions during the design activities. They felt empowered, confidence, also pride of being asked to participate in technology design activities, but also a sense of competence. Our participants were viewed as experts, which we thought was essential in the development of the technology. And they offered input from life words that were far away from our own, which makes their opinions very important. And they felt feelings of pride and also feelings of competence in being in a position where they had new information for us. To continue, the participants also described feelings of positive behavior in terms of engaging in working with the technologies, ideation workshops, coming up with different ideas. They also thought that being part of the process was meaningful. This was linked to that they could also use the technology themselves when the technology was developed, as well as this technology could help other people with intellectual disabilities. They also described coping as the design activities were something new to them. They hadn't been part of activities like this before, and being a part of it and managing to be a part of the activities was seen as important for them. The participants also described developing new skills and abilities, mostly connected to the technology as well as the design process. They described knowing more about how technology is designed, more about the process in which technology is designed, but also about how research is conducted. Most of our participants had smartphones with Snapchat and Instagram, but knew very little about how the technology was developed. We have also looked into what motivates during design activities. The participants described involvement as a very important motivating factor. Having the autonomy to be a part and take decisions, as well as being listened to and being able to influence the design and the solution. However, the participants also thought that it was important to influence the design activities, choosing which activities they would like to participate in and not. For instance, in some activities, they can choose between drawing or writing, taking pictures or describing. So these were things that were motivating for them because they could have autonomy in the situation where they were being a part of. The participants also described the design activities as a social event. They could meet new people that they wouldn't meet in other contexts, as well as they could develop new social relationships with other people. The students participated in groups from school and viewed the design activities as a social arena to get to know each other even more, as well as getting to know new people. We also had social lunches and used quite a lot of time together, which they found motivating. Also, the importance of enjoyment was described as a motivational factor. Enjoying the design activities, which stems from intrinsic motivation, being a part of activities because it's fun to be a part of. So this was also an important motivational part of being part of the design activities. So here, in terms of enjoyment, enjoying the activities can also help ensure that there are more positive than adverse or negative experiences. So in terms of pinpointing how or which specific activities lead to certain experiences, we found it difficult because some participants enjoyed taking pictures, theater or role plays, while others find prototyping in real settings as pleasurable. And while some find activities difficult or challenging, like drawing or taking pictures, other participants did find them enjoyable or familiar. For instance, when using photo voice, some participants took a lot of pictures. They had Instagram, used photo voice, used Snapchat, I'm sorry, a lot. Other participants had not used the camera on the phone a lot. So this just shows that there are very different experiences, and also this leads it to being very difficult to pinpoint how specific activities or even roles lead to specific experiences. So while participation in design activities was primarily a positive experience, some participants also described some adverse experiences, such as boredom or low levels of focus was also observed. A lack of interest in some design activities was also observed, and also non-engagement. So some participants described, for instance, drawing as boring and did not want to draw, but as long as we can facilitate to something else, we could mitigate around that experience. And it is also very important for us to pinpoint that it is the researchers or designers' responsibility to ensure that participation is primarily a positive experience. So facilitating during the design activities when working with people with intellectual disabilities is important. So some of the implications we've had is facilitating, where we focus on preferences and individual needs and not diagnosis was important. Also evaluations throughout the design activities. Participating over time was important, as the participants could then get more confidence and trust, and also the in-depth knowledge we could get from having the same participants over time could help us in facilitating the activities better. One interesting finding was also the balance between facilitating and challenging. Challenging the participants was also very important to keep their motivation during the design activities. So this is also linked to participation over time. The in-depth knowledge we could get from knowing the participants better could help us in tailoring the activities, so we could also challenge them during the technology design activities. So in for landing, the website is inarbeid.uia.no. There is more information about the project there. Also information about the publications that have been done. And if you're interested, there is also an opportunity to get newsletters as well. The reference used during the presentation. And lastly, if you have any questions or interested in knowing more about the project or even comments on this presentation, please do get in touch. Thank you very much.
Thank you very much, Chris. You also made it really good in time. Thank you again. And I have a question here to you. From your point of view, what is your opinion about the most important issue when involving participants in this kind of project?
So I think that their input towards technology was very important for the project, but also in terms of agency and ethics in disability studies. The Nothing About Us Without Us movement has been ongoing. So involving the participants throughout and securing that it is real involvement and not tokenism was very important. So in this kind of project where the technology will at one point be used by themselves, we got a lot of feedback on the technology and mostly on things that we could not think of ourselves. It could be color or what kind of pictograms were used, what was understandable and not. So there were a lot of things that we as researchers or designers could miss on, that they could give us feedback on.
Yeah. And as I reflected to Undine as well, it has to do with what you did say now. The user in the center is so easy to say, but just again, a more of a reflection how important this kind of research you're doing.
So in terms of technology development, a lot has been known about the effect of user involvement. It can lead to better technology, better user satisfaction. But we also see that there is a lot of user gains that participants get from being involved. So there is two sides where both sides can actually win by involving the user in the design activities as well, in terms of learning, in terms of being a part of society as well, and being able to be part of something that is meaningful. And people with disabilities don't have many areas in their lives where they are viewed as experts, but design of technology, for instance, is one of those opportunities.
I think that's excellent to start with that statement and that answer, Chris, because that's really what it is all about. A big great thanks so much, Chris, for your presentation and for this short chat that we have now afterwards. Thank you very much.
Thank you very much for having me.
Yeah. And now we will go on. We're having a panel discussion based on what we have been hearing here, and the one that will do this and organize this and moderate this is Gunhilde Rotvold. So I give the word to you, Gunhilde, and then the ones that are going to be in the panel will join right now as well, and I will be here as well. I will to say to you all the participants to put questions in the chat, and I have saved one question about the definition of welfare technology in Norway, but we could take that sometime during this half an hour, put that question in. But I think you have planned how to start, Gunhilde, so I give the word to you.
Thank you, Bengt. And yes, I'm sitting in Tromsø at the Norwegian Centre for e-health research. I'm a colleague of Undine, who has already been presented herself, and she is also part of the panel. The same is Helena. You all also have met her. And I will introduce you for Elin Tygesen. Will you present yourself, Elin?
Hello. Can you hear me?
Yes.
Yeah. Okay, my name is Elin Tygesen. I'm working at the University of Agder at the Centre for e-health, and I'm also a part of this core group for this network.
Thank you, Elin. And then we have Yvonne Eriksson.
Hello, I'm Yvonne Eriksson, and I'm a professor in information design at Mälardalen University, and I have been working together and for people with blindness for almost 25 years now, and in research or in more practical sense as well.
Yeah. We have had two nice presentations, and I think I will start with one general question to the panel. The question is, what challenges do we face when it comes to implementing new technologies for people with intellectual disabilities? Would one of you like to start, or should I point at someone? Yeah, Elin, please.
Yeah, I can just jump into it. I think it's a very interesting and important question, because in this question we maybe can find a solution. But I can give some reflections of what we have discussed in the Inner Bay project. In the Inner Bay project, as Chris told, we are trying to develop new technology solutions. And of course, we are also dealing with the questions about how to implement this, how can our solutions be useful in the practical world. And one of the big challenges we have seen and have discussed is that it's about placement of ownership of the solutions or the technology. Often very many actors are involved in the lives for persons with intellectual disabilities. And we also see that these persons are representing very different organizations, and maybe they don't have natural channels for cooperation. And also these solutions, they require that we cooperate. And the big challenge can be in many situations to place the responsibility. One problem is to place the ownership, and the next one is who will be the responsible, who will make the decisions, who will pay for the technology, and who will follow up and implement and support the use of the technology. So I think that's maybe is one of the really big challenges and very concrete what we are dealing with in the Inner Bay project.
Yeah, thank you, Elin. Some of you other had comments on this? Yeah, Yvonne, please.
Yeah, I will take this from a little bit another angle, and I think it also has much to do with attitudes, expectations, and norms.
Yeah.
So when we create new technology, from the beginning start to think of people with some kind of disabilities, and in this case we talk about people with intellectual disabilities, but it's very often also that people with intellectual disabilities also suffers from other kinds of disabilities, additional disabilities, such as limited eyesight, of lack of hearings, etc. But I think that the most challenging thing is to really include different aspects of user interfaces for people, in regular user interfaces. How can they be accessible for people with intellectual disabilities? And then we need to have clear interfaces that contain a logical hierarchy, where to go and where to look. And it's very much the requirements on the layout and the graphical element. Is it logic? Is it easy to find? And also that I think something which is missing today is embedded instructions, how to use the technology. And by that, I mean, how can you use it more intuitively? And by that you can, if it's more intuitively to use, then it's also more easy for people with intellectual disability. But there you also have some problems. How to know where you are looking for. So how can you present things so it will be obvious for people that really don't know what to look for? How can it be clear that you start here? And I think you presented very nicely, Mugula Chris, about how you work together with designer, work together with people with disabilities. But I think we do have a challenge here. Most designers are aware of user-centered design, and usability is very important, but they don't have the experience of working together with people with some kind of disabilities. And they don't even think of that they could gain knowledge from people who will use the interface or the product in the end, because they are very much into creating a product itself. So this, I will start with this. Thank you.
Thank you, Yvonne. Before I give the word to Helena, I just want to remind all the members who are listening to us, please send messages in chat if you have any questions. Helena?
Yes, thank you. Undine's and Chris's presentations were enormously interesting and also gave a lot of information already about this question too. But I would raise three things: knowledge, methods, and then understanding of the practical and policy levels. So when you talk about knowledge, that's actually perhaps a pre-implementation stage that we would then talk about, because it's quite often so that potential users of health and welfare technology do not necessarily know about the opportunities, about the different devices, different solutions, and their opportunities, and how to get them and how to use them, and so on. And when you talk about people with intellectual disabilities, then it's also often their close ones, their families, who have a big role to play. So they would also need much more knowledge than they often have at present. And then it's also about the knowledge of implementers. So do they actually have enough knowledge about these opportunities, and for whom a certain device or solution is actually good and beneficial, and so on. And then about the methods, Chris already talked about these different types of methods that are needed to listen to these people's needs. But then it's also really about a question of methods, appropriate methods, or tailoring the methods for the implementation by the implementers, so that they are skilled enough in tailoring the methods, and also following up concerning how the use is actually how successful the use is. And then about these practical and policy levels, it's very important to take both levels into account, as was also discussed in the presentations. So understanding and acknowledging this complexity that was brought up by Undine. Thank you.
Undine, would you like to comment on this? Are you there, Undine?
Yes.
Okay.
I saw Yvonne raised her hand, but should I?
Yeah, you can just comment first. Yeah.
Yeah. Maybe I bring up just a new aspect here too, because when you talked about knowledge, Selina, I also thought about actually what we see happening many times is that there is a lot of welfare technology and technology stored in the cellar of the people because the child doesn't want to use it. And why does the child, or it's said that the child doesn't want to use it, and why does the child not want to use it? So it's about actually the core person here, the child, that you can create as much technology as you want. If you don't, if you are not able to address the child in the right way, then you also, as Elin says, and Yvonne says, then you will not succeed with all the technology you have around or you are creating. And then again, also the people you are depending on as a child with disabilities, they actually have to gain knowledge too, in order to be able to, like family, like personal assistant, like others. And that means that demands also that they are both willing and trained, trained enough to help or trained enough to know by themselves. And then we have the aspect that if technology is implemented in this process, it has to be in a holistic way. For example, when a child is successful with one technology at home, why don't use the same technology at school? For example, technology that can help a memo planner or something like that, that can help structure your time, that can remind you of when does lunchtime stop. And this to be reminded could help you not to become so nervous about what happens next, what's many times happening with children with cognitive disabilities. So then implementing it at school demands something by the teacher, by the special pedagogues, by the IT system, by others. So it's going into this or demanding something into a more holistic system. And then school is not the only institution. There are other institutions, and maybe there are actually services for the child that go across the sectors, and where it would be interesting or necessary to actually implement technology across the sector to give the best service to the child. Thank you.
And then, sorry, Yvonne, I didn't see your hand, but please.
No problem.
I think after your comment, we will change topic for the discussion.
Yes, I just want to comment because I think we're talking very much about involvement, but we're talking about the primary users. And in this case, it's people with intellectual disabilities. But I think it's very important also to include people around, as have been mentioned before. It could be either staff, caregivers, parents, etc. Because if they don't know how to use the technology, then there will be no real introduction, because I think many times you need to have help and you also have to be inspired. So as you said, Undine, there is a lot of technology that is not used at home. Maybe it's not only because of the children, it could also be because of the parents don't know how to handle it. So I think in this design process, I think it's a good idea to both involve primary and secondary user to get good results and how they could interact. Thank you.
I think I will go to the chat and to follow up what Bengt suggested for the first question that came after Undine's presentation. And the question was, what is the current definition of welfare technology in Norway and how does it relate to e-health? And following by another question saying, is welfare technology explicitly used in legislation? Would perhaps Elin or Undine from Norway try to answering that, or?
I just can say there are many definitions of welfare technology, but the one we related to was the one of NOU 2011. And this is quite broad. I could read it in Norwegian, but it's saying something about giving technological assistance and contributing to increased safety and social participation, mobility, and physical and cultural activity in order to strengthen the individual's ability to actually cope everyday activities. It says more things. And then the question whether this could be related to e-health then. And I think it can, in the way that e-health also demands a broad definition. And I would say it's both. E-health is both the technology used at the home of people in order to help yourself and to forebygge, hva var det nå igjen? Prevent illness. And as preventing illness, then we can think about very many different types of patients, people with chronic diseases, and this could be then technology and both hospital and municipal healthcare systems can take part in preventing illnesses remotely. So I think okay, I'm with chronic diseases now, but I know, for example, children and youth with disabilities can have many conditions that demand also specialist care and primary health care in.
I know that the concept of welfare technology is very difficult because when you are doing literature search, for instance, and trying to find correct search words for what are you going to looking for, what kind of research do you want to look for, it's difficult to limit the concept. But does Sweden and Finland have other definitions of welfare technology? I know that in Sweden they call it health and welfare technology. In Norway we say only welfare technology.
I think the definitions is almost the same.
Yeah.
Yeah, I would say so. Or there are many definitions, but the basic features or basic characteristics are the same. But the definitions usually do not really include the care professionals' point of view. So I think that that could be included better.
Elin, would you like to say something?
It's maybe mainly the same as talked about, but I think the e-health concept is broader, and it's also, especially here in Norway, I think maybe also the same in other Nordic countries. I think we have up till now separated between welfare technology and more medical technology or medical follow-up technology. That welfare technology is more about safety, security, coping, and living an independent life at home. While medical technology and remote distance follow-up by medical technology is more about treatment over distance.
Thank you. And Yvonne?
Yes, I only wanted to add that also the term welfare in Sweden is also kind of a political statement. You said that you can't have a healthcare if you don't have a welfare system. So it's therefore also it goes together, health, welfare and healthcare. So.
I saw that there was another question in the chat that came up, and it says, often one can get money to a project. It is not often to get money for implementation. In example, by staff free to practice the technology. What is the panel's view on that? So this is actually about moving from the pilot to the implementation phase. Who would like to start?
I can start because the implementation phase is much more complex, and you also need, and then we come back to the political decisions. You need to have money to implement it, and also it's often that when you start to implement it, you realize that you come with a small part, and it needs often a whole system, and maybe they can't connect to other parts in the system. So it's the implementation on a big scale is often very, very complex. And I think this is, you're asking about the challenges. I think this is one of the challenges. How is it possible to implement it in a system? Should you start by thinking of the system, or should you start in the small scale? I think there is a contradiction there. Thank you.
Helena, I saw your hand.
Yes, I agree with Yvonne, and I would, in my view, it's often so, at least in Finland, that these pilots interest people greatly, and that's no wonder. They are very interesting, of course, but when you talk about implementation, it's often very basic issues that we then bump into, regardless actually of the technology. Of course, there are also technology-specific problems, but then there are also these very basic issues that you have been there for, let's say, tens of years, and they still haven't been solved, basically. So that's maybe less, it's kind of more about daily issues, and therefore seen as perhaps somewhat less interesting by some people.
Thank you. And Elin?
I was muted. I think I have been following some implementations projects, and in many of these cases, I think many municipalities are very eager to solve all the practical issues in the specific implementation. And in a way, they forget the next phase, and also maybe also forget to have good plans for the next phases about use, follow up, have time for employers and all the people in this holistic system to have enough resources. So it is important to also have a plan for this follow-up phase, and even more than we see today.
Very wise answers from all of you. Do anyone else want to comment on this? Okay, I think I move to a last question. If Bengt, I don't know if there are any more in the chat, but I have a question to the panel.
No more questions right now. No.
Okay, that's good. So, another questions. Why is it so important to? No, I'm sorry, we have discussed that. The question I was going to ask is, how can we further disseminate the knowledge that we have to reach disability practice in the Nordic countries?
Can you repeat the question, please?
How can we reach the practice? How can we share our knowledge to the practice of those who are working with children and youth with disabilities? Yeah, come on, Yvonne.
Thank you. I think we have to involve them much more. And as I said before, we're talking about the primary users, so to say. But I think if we involve people also working in the system and make them a part of it, and as Chris so nicely described that what users gain from being involved. I think if you involve people working with these questions in practice, if they got involved, they would probably also gain some inspirations and get more interested in taking part of already the knowledge that already exists. Thank you.
Yeah, Helena?
Yes, I would also say that it's a question of information design, Yvonne's special field. So finding the appropriate channels and ways to communicate these issues to for instance, let's say patient organizations and policymakers and different kinds of people who have different information needs. Just briefly.
And Elin?
Much is said what I was thinking of, and especially this involvement I think is really important, because persons need to see the value of it, and if people see the value, they will be enthusiastic, and then we will also have ambassadors showing colleagues, showing parents, showing those who need to be convinced that this is useful. So involvement, and not only the end users, but all persons around, is really important, I think.
Well, I think we are close to ending this panel discussions. And Bengt, I'm not sure if you would like to say some closing words, but I would like to thank the panelists for a very interesting session. Thank you all for contributing so well.
Yeah, and I thank you Thank you again. Thank you everybody for contributing and having this very nice and interesting discussion. And thank you again, Chris and Undine, for your presentations and on this very important area. I just want to comment on what the last two questions you had, that I think what you have in Norway that we don't really have in other Nordic countries is the welfare technology program. You also have the Veikart för tjänsteinnovation, a roadmap for service innovation, färdplan för tjänsteinnovation. When you work with insight and anchoring in the start, and that's really where you more or less success when it comes to implementation. And also you reach through Norwegian Centre for e-health research to the municipalities and to the staff with the work you do there. So I think it's very impressive that what you do in Norway when you look at it from a Nordic perspective. So thanks a lot for hosting this webinar again, and we will be back with webinars in the autumn. We have plans for what we will focus on, but if you have ideas what we should focus on later on, and maybe one of the webinars this autumn, you're free and welcome to contact us through via in the network. And we will continue with the activities as Helena and I presented in the start of this session. And 1.5 hours goes very quick when you having so fun that we have had now. So I say thank you to you all and see you again. Bye.